Thank you for coming to the East West Medical Group Spring 2026 intern presentation. And we are always encourage all the intern do the research and for the something they are interested about, and then to enrich their medical knowledge. And also I'd like to use this opportunity to say thanks to Dr. Cohen. He's a doctor to make everything happen. Thank you, Dr. Cohen.
Thank you, Dr. Sai. Here. So we have 4 of our interns here are going to present on breast cancer. They've worked very hard this semester, and I want to hear what they're going to say. So when you come up here, introduce yourself, and let's get started.
Hello, everyone. My name is Sarah. Hi, my name is Katrina.
Ms. Lynna.
And my name is Mia.
And we decided to do our research on breast cancer. So why breast cancer matters? Breast cancer affects millions of people worldwide, both men and women, and it is most common in women. And statistics show that about 1 in 8 women will be diagnosed with breast cancer in their lifetime. And we chose this topic because it is very personal to us, and it also impacts families everywhere around the globe. Early detection improves survival rate significantly, and screening is important because breast cancer can develop before symptoms even appear and before the person even knows it. And screening helps find cancer at earlier, more treatable stages. So what is breast cancer? Breast cancer is a disease that can develop in one or both breasts, wherein abnormal cells grow uncontrollably. And this can create a mass known as a tumor, and you can go ahead and see that on the left-hand side with that image. And that can also spread to other parts of the body. And in a normal body, normal cells will grow, divide, and die in a controlled way, where DNA regulates normal cell growth. DNA mutations can cause cells to grow too quickly and ignore signals to stop dividing. And most breast cancers begin in the milk ducts or the lobules. If it begins in the milk ducts, it's known as ductal carcinoma, or in the lobules, it's known as lobulocarcinoma. And it's dangerous because cancer cells can invade nearby tissue, and in advanced stages, it can also spread to the lymphatic system or even into the bloodstream. So here's more on the anatomy of breast cancer. You can see the milk ducts. We discussed ductal carcinoma, which is the most common form of breast cancer, and also in the lobules, lobulocarcinoma, and lymph nodes, which is underarm, and then it could also spread to the other parts of the body, like the bones, liver, lungs, and even the brain. And so screening is so important, like we said, because it's easier to treat at earlier stages. So there are a few options that we have. So mammogram, it's the most common screening tool, where they use low-dose x-rays to detect tumors. There's also breast ultrasound, which helps examine suspicious lumps, and it's often used alongside mammograms. There's also breast MRI, which is used more for high-risk patients, and it creates detailed images of the breast tissue. And then there's also clinical breast exam, which is when you go to a healthcare provider and they will assess and see if there are any lumps or abnormalities. There's also breast self-exam, when you just feel around the breast to see if there's any abnormalities or if you notice any changes, which is a very important tool, and it's very quick and easy from your home. And then recommended screening age is around women ages 40 plus. They should be discussing regular mammograms with their doctor because that is when you are more at risk, and high-risk individuals may begin screening at an earlier age. And now the stages of breast cancer starts off stage 0, which is non-invasive, and then it reaches stage 1, which is a small localized tumor. Stages 2 and 3, it's larger and it spreads to the lymph nodes. And then stage 4 is called metastatic cancer. And then on the right-hand side, you can see kind of a visual, an image that kind of shows what that looks like in the body. And then there are a few myths that are commonly talked about, and so we're going to debunk them a little bit. So myth number 1 is only women get breast cancer. This is not true because men can in fact develop breast cancer as well, although it is more common in women because women do have more breast tissue, but men are still at risk as well. The second myth is a lump always indicates cancer. This is also not true because a lump can be non-cancerous, but it is always safe to go ahead and check that to see if it is cancerous. And lastly, young people cannot get breast cancer. This is not true because risk increases with age, but young people can still be at risk to develop it.
Hi, my name is Katrina. Continuing, I'll be going over the symptoms of breast cancer. So breast cancer often does not show symptoms in the early stages, which is why regular checkups and screenings are important. Common symptoms may include a lump in the breast or under the arm that can be thick or firm, changes in the size or shape of the breast, nipple changes like fluid or discharge, or changes in nipple shape or direction, skin changes on the breast or the nipple, including redness, dimpling, swelling, itchiness, or a rash, swollen lymph node under the arm that may feel like a lump, swelling, pain, or discomfort in the breast, even without a lump present. Overall, any unusual breast changes should be checked early by a doctor. And to the right, there are some up-close images of these common symptoms. So next, I'll be going over the causes and risk factors for breast cancer. So the causes include cell changes and DNA mutations, aging, inherited genes, radiation exposure, and hormones. So breast cancer happens when cells in the breast develop changes in their DNA and start to grow out of control. As people get older, cell damage builds up over time, which increases the risk of breast cancer. Some people may inherit gene changes such as BRCA1 or BRCA2 that make harmful cell changes more likely to happen. High levels of radiation can damage cells and increase the chance of breast cancer. Hormones like estrogen can make cells grow more, which increases the likelihood of mistakes that can lead to cancer. And below, you can see a photo of the DNA damage and how it can lead to the development of breast cancer. So risk factors include personal history, reproductive history, lifestyle factors, family history, and race. Women who had breast cancer or certain breast conditions have a higher risk of getting breast cancer. Early periods, late menopause, having children late or not at all, and not breastfeeding can also increase that risk. Lifestyle factors like drinking alcohol, being inactive, or gaining weight after menopause can also raise that risk too. Family history is important because having a mother, daughter, or sister with breast cancer increases the chance of developing it through genetics. Race and demographics can also affect incidence and outcomes for breast cancer. And below, there's an image showing some more breast cancer risk factors.
Hi, my name is Lynna, and I'll be talking about modern breast cancer treatments. So when it comes to surgeries, there are three kinds. A lumpectomy is a surgery that removes a portion of tissue of the breast. It removes the cancer and some healthy tissues around it. It is a treatment option for early stages of breast cancer and is normally followed by radiation therapy to help lower the risk. It is normally not recommended if you have a larger size breast cancer compared to the size of your breast, or if there's not enough healthy tissue. It's also not recommended if different areas of the breast have cancer, if the woman is pregnant, or they cannot have radiation therapy due to other reasons. When it comes to a mastectomy, it is when it removes all breast tissue from the breast, and it can sometimes also remove the skin and the nipple. If it is one, it is called a unilateral mastectomy, and if it is two, it is called a bilateral mastectomy. It is treatment for ductal carcinoma in situ, or non-invasive breast cancer. It is also for early stages of breast cancer, such as stages 1 and 2, and breast cancer that comes back or reoccurrent. It can also be used after chemotherapy, in which is stage 3 or locally advanced breast cancer, and for inflammatory breast cancer as well. It is recommended if you have 2 or more areas of breast cancer in different parts of the breast, if you had radiation in the past and the cancer has come back, if you are pregnant, or if you have large area of the cancer compared to the size of your breast, and if the DNA indicates you're at high risk of cancer coming back. When it comes to lymph node removal, it is an injection, usually by a radioactive substance or a dye. In this case, if the dye turns brown or blue, the surgeon then that is the affected lymph node. The surgeon will then cut the area in which it removes the lymph node, and then it usually is done at the same time as a mastectomy. It is usually, if a few nodes are removed, it is called sentinel lymph node biopsy. And if a lot are removed, such as 10 to 40, but the range is usually around less than 20, it is called an axillary lymph node dissection. Now moving on to radiation therapy. Radiation therapy uses high energy X-rays or protons to kill the cancer cells. For external radiation, it uses machines that delivers the radiation, and this one is the most common. For internal radiation or brachytherapy, it is for after surgery, in which it places radiation delivery device in the breast. It is used to treat breast cancer at any stage, and it reduces the risk of cancer from occurring after surgery, so it's often recommended to use after surgery. For hormone therapy, it is a treatment that is sensitive to hormones. It blocks the hormones from attaching receptors to the cancer cells, in which it can shrink the cancer before surgery as well. It is used for breast cancer as it is found to have receptors for estrogen and progesterone. So ER plus is when the breast cancer is sensitive to estrogen or estrogen receptor positive. And PR plus is when it is sensitive to progesterone or progesterone receptor positive. Usually in these tests, it is taken in a lab, and it's whether or not the cancer will have receptors to progesterone or estrogen. If at least 1% of these cells have these receptors, then you can be considered for hormone therapy if you have breast cancer. Now, when it comes to tamoxifen, it is a selective estrogen receptor modulator used to treat breast cancer. It is drug effective with estrogen receptor module positive tumors, in which the FDA has approved it for after surgery use and radiation. It is usually in a tablet or oral form, in which tamoxifen binds to the estrogen receptors, and it blocks the effects, preventing the growth of the cancer cells. It is also used to mimic estrogen effects in bone tissue, in which it can increase bone mineral density. But there are side effects of tamoxifen, in which it causes proptosis or bulging eyes, cataracts, and retinal deposits. Moving on to chemotherapy, if it's called after surgery use, it's called adjuvant chemotherapy, in which it destroys any undetected cancer cells left over, is usually helpful at high risk or reoccurring or spreading of cancer. For before surgery use is called neoadjuvant chemotherapy, and is used to shrink the tumor and or remove it completely. This is helpful as it removes any cancer and not the breast itself. Since it decreases the lymph nodes, it allows for a less invasive surgery overall and helps doctors understand how the cancer reacts to the chemotherapy. It is usually for inflammatory breast cancer, triple negative breast cancer, and HER2 positive breast cancer. When it comes to chemotherapy, it is usually given from the vein through an injection, or you can do it for an infusion over a long period of time. This is through catheters or devices as well. It is given in cycles and periods of rest. Most cases, chemo is better when it is with a combination of drugs. However, advanced chemotherapy is still often used with one drug at a time. Examples of popular chemotherapy drugs would be paclitaxel and doxorubicin, and doxorubicin and epirubicin. Now moving on to targeted therapy. So if this targeted therapy targets proteins that control the cancer cells in which the cancers grow, divide, and spread. Through monoclonal antibodies, the proteins are designed to attach to specific targets on the cancer cells, in which the anti-drug conjugate helps carry the chemotherapy drug to the cancer cells without invading or harming other cells. Usually trastuzumab is used for this, for HER2 protein. Now, going into the HER2 protein, it is most common in breast cancer as it is a relevant biomarker for treatment and is most efficient in targeting HER2 on the surface of breast cancer cells. It works by blocking and turning off signals that tells the cancer to grow and divide. And overall, it just triggers the immune system to kill and recognize the cancer cells. Last but not least, I'm going to be talking about AI and imaging. Today, they are being used for mammographies with automated breast cancer screenings and ultrasounds to help with diagnosing breast lesions and tracking prognosis. However, there are a lot of mixed reviews about it right now when it comes to the arguments or benefits of whether or not it enhances any accuracies or efficiencies with early detections and diagnosis. Also, whether or not AI assistance of breast cancer diagnosis helps alleviate any clinicians at all. There are a lot, there are a lot of challenges, such as data processing protocols, since there's not any, there's a lack of large-scale databases, the cost of AI, the biases, data privacy, and whether or not AI falls under any ethical guidelines, and false positives. It also just risks. Also, there's a debate on whether or not is a risk to the workforce, as there are scarce radiologists at the moment when it comes to mammographies. Hello, my name is Mia. And oh, did you have a question? Okay. As we mentioned, AI has been used as a support tool to analyze medical images. However, AI is not meant to replace radiologists. Sometimes AI identifies findings that doctors may miss, while radiologists can also recognize concerns that AI might have overlooked. Because of this, the best outcomes usually comes from combining AI analysis with the expertise of healthcare professionals, so that together they can reduce missed findings and improve early detections. Next, I will be briefly going over some Western treatment techniques. Western treatment techniques uses several evidence-based approaches to treat breast cancer, and depending on the stage and the location, as well as the type of cancer. One common treatment is chemotherapy, which uses drugs like anthracycline, and taxanes to destroy rapidly dividing cancer cells. Hormone therapies, including tamoxifen and aromatase inhibitors, help slow hormone-positive cancers by blocking or lowering estrogen levels. And then, as we have mentioned, targeted therapies such as HER2 inhibitors like trastuzumab or Herceptin specifically target cancer proteins while causing less damage to healthier cells. Supportive care is also important during treatment. Many patients experience side effects like peripheral neuropathy, fatigue, and emotional stress. Specifically, taxane chemotherapy drugs are commonly associated with peripheral neuropathy. So it's important to take care of those side effects as well. Surgery is also another major treatment option, and we have also mentioned the lumpectomy, mastectomy, and then also lymph node removal. And then next, in addition to Western medicine, some patients also use complementary or Eastern treatment techniques to help manage symptoms and also improve quality of life. Acupuncture may help reduce chemotherapy side effects such as nausea and fatigue, and then chiropractic care can sometimes help with musculoskeletal pain and mobility issues. Massage therapy is often used to reduce stress and anxiety during treatment and also help with recovery. Some patients also use herbal treatment. However, it is important to regularly monitor them because they can sometimes interact with cancer medications or treatments. And then next, I wanted to include a more personal example as a case study because my mom was diagnosed with stage 1 breast cancer. Her cancer was luckily detected early, which played a huge role in her whole treatment and recovery journey. After imaging and testing, a biopsy was used to confirm the diagnosis. She underwent a lumpectomy to remove the cancer and then followed by radiation therapy. And she was later on prescribed tamoxifen as her hormone therapy treatment. And throughout her treatment, ongoing monitoring and follow-up care became very important because tamoxifen can cause side effects. So she now needs to do a yearly transvaginal ultrasound as well as eye exams every 6 months to monitor her health. Being with her through this whole process showed me how important early detection, regular screenings, and continuous medical care really are. It also highlighted the emotional and physical challenges that many patients and families experience during treatment and recovery. So get screenings. One of the most important ways to reduce the impact of breast cancer is through regular screenings. Screening helps detect cancer early, often before symptoms appear, and then when treatment is usually more successful. Women at average risk are generally recommended to begin mammogram screening around the age of 40, while people with high risk factors such as family history, genetic mutations, or previous chest radiation may need to start earlier. And then although breast cancer, like we said, is less common in men, they can definitely develop breast cancer, so they should talk to the doctor if they notice any changes. Regular mammograms between ages of 40 and 74 can significantly improve early detection. So staying aware of your own health risk and then reporting any changes of your breast to your doctor immediately is very important. So overall, early detection saves lives, and screening remains one of the most powerful tools in breast cancer prevention and care. Thank you. Here are references.